At least 9 strains of the novel coronavirus are ravaging the world. This is according to the scientists at the Kenya Medical Research Institute after they analysed 122 samples for the virus. However, the severe acute respiratory syndrome, coronavirus 2 strain causing infections in the country, is not that different from the others circulating around the world. The team's lead researcher, Dr. Isabella Oyer, a senior researcher at the head of bioscience at the Kemri Wellcome Trust, Kilifi, explains.
So what we did was, once we sequenced the 120 samples, we compared it with sequences that had already been publicly deposited in a database from across the globe to look for where the viruses that we found in Kenya have come from. So the team are working on this, found out that we have 9 importations or nine introductions from across the globe. So essentially, it's saying so from different countries, from 9 different countries, we've had importations of the virus into Kenya. And then what's also able to tell you is how have those viruses been moving locally? How have they spread locally? And if they're spreading, for instance, between cities, so for instance, between Nairobi and Mombasa. So in terms of origin, what the sequences in Kenya are related to globally. It won't tell you that it came from England. So you wouldn't say it's an English virus or it's a Chinese virus, because when you look at the sequences, they're all very related. But in terms of tracking, it just allows you to track where the parasite has gone. So since the start of the spread, so you will find that the virus has been moving perhaps from China into Europe, for instance, China to the UK and then down into Kenya. So it just allows you to track it. But in terms of origin per se, they're not like separate origins of the virus. And that would help us understand how it's spreading within the population. So it will help us understand the spread. It will help you understand if it's moving sort of between cities. So for instance, if you were to put measures in place, lockdowns, if you didn't now see a virus moving, no similar virus between the population in Nairobi and Mombasa, then you could say that whatever barriers or whatever interventions we have put in place to stop the viral spread, if that's working. So this is where viral sequencing comes into play in terms of understanding what the interventions you put in place. How is that helping the spread of the virus? So it helps us track the virus, or even our testing capacity. So for instance, how we're currently testing, if any changes happen in the regions we're looking at, in any of those letters that we're looking at, then that might compromise our testing capability. So it's not a rapidly mutating virus. The mutations we've identified have helped us show you how similar the viruses are here versus globally. So in terms of the data set we have at the moment, there's no evidence to show that we have a rapidly mutating virus, which for now is a good thing in terms of when you're thinking about interventions that you'd use in one country versus another. So this is the importance of just monitoring the virus across the globe to see how fast it's changing. Because if it's not changing very fast, then whatever intervention you use in one country, you could probably use in the other. And so that will help again in controlling the pandemic.